The Association of Radiation and Clinical Oncologists of Nigeria, ARCON, has decried the insufficient number of oncologists in Nigeria. The president of the association said this in Abuja on the sideline of a media briefing on the association's fifth annual conference with the theme Redefining Cancer Care in Nigeria. According to her, Nigeria has less than 100 oncologists, while the international standard should be one oncologist to 100,000 population.
Now, in terms of the treatment, so even as we say that our girls are getting and our young women are getting cervical cancer, there is a ray of hope. Once it is caught early, we can offer standard of care which includes chemoradiation therapy, and these patients can be cured. But the truth of the matter is we really don't want these patients to come in with the disease, which is why there's a lot of advocacy going on now for screening and preventive measures using the vaccination that you talked about. Unfortunately, we don't have the vaccines readily available in the country. And this is not peculiar to Nigeria, because we know that we are just post the COVID pandemic. And during that period, most of the vaccine producing companies actually transitioned to face COVID.
The Secretary General said that there was a dearth of radiotherapy equipment, as the global standard should be at least one machine to a million people.
Presently in Nigeria, we still have less than 20 that are functional. And as a matter of fact, even when you talk about functionality, we have probably about 10 or thereabout. And the implication of that is that most of our people, our citizens, have to travel between 50 to 100 kilometers or a little more before they can access it. And there's also the challenge of payment out of pocket. A regular comprehensive treatment of cancer might be about between 500,000 to maybe like a million and a half. And when you talk about a million and a half for one person's comprehensive treatment, and we believe that with our engagement and with the media engagement and also the stakeholders and the policymakers, if they can actually invest more in healthcare and also increase the access, people, even those that want to do private firms and also the health insurance.
The conference, which began on Monday to end Wednesday, will discuss innovative solutions to ameliorate the issues of cancer in Nigeria.